My name is Dr. James Gruft, and the name of our center is From Pain to Wellness. The reason it's called From Pain to Wellness is because we believe that you need to be on a journey going from your pain to wellness. What does that mean? That means that every part of your life has to be explored because you didn't get into the pain condition you got into overnight. It happened over a period of time. And we have physical therapy, we have psychology, we have licensed dietitians, we have nurses. Everything we do here is under strict medical supervision. People come to us after they've been to a lot of doctors. 5, 10 doctors is our average. And the biggest complaint I hear is that the doctors are not listening to them. So we sit with our patients and we listen to them. And we try to figure out what is going on with this patient. Why are they so physically impaired from their pain condition? And it's usually multidimensional. It's not one thing. Yes, they have physical pain, definitely, but it's how the pain is affecting them. So they have poor sleep, and they eat crummy. They have miserable diets. Their relationships are strained. So in this center, we treat every aspect of that person's life. The physical part is dealt with by our physical therapists. So they're experts at getting posture realignment, the core body stabilization, getting a person's endurance back, getting them limber again so they don't feel stiff when they get up or they do their activities, get their strength back. This is all the purview of a physical therapist. Then the other important thing we do is dietary modification. Now you might not think that dietary modification is an important part of pain management or pain treatment. It is. Diet can have a huge effect on a person's pain. And we spend a lot of time going over a person's diet and trying to maximize the nutritional density of the food that people are eating so they can heal better. And I'm telling you that after doing this for over 20 years, I've never seen patients get better than they do now as a result of doing dietary modification in addition to everything else that they're doing. Then there's stress management. Stress management is an important part of treating a pain condition because pain causes stress. And stress can increase pain. So you got to get the stress to cool down. And how do you do that? Well, there's a lot of different techniques that you can learn to decrease your stress. And you might only connect to 1 out of 10 different methods, but that's okay, as long as you connect to the one that you're comfortable with. So we throw out a lot of different techniques of dealing with stress: meditation, guided imagery, progressive muscle relaxation. There are a lot of different things that one can do to decrease their stress. And you know, you might be the one that really, really likes meditation. So that becomes your main stress management technique. And that's another aspect of pain management that kind of fits together with the dietary modification and the exercise. And what is going on while all of this is happening is your life is starting to change for the better. And what we see here, which is amazing to me, is we see people's lives transformed by this approach and getting better and better and better. And people will come to, our patients will come to us and say, I have never felt this good in a long, long, long time.
What's unique with our practice is that we are not influenced by diagnosis bias, which is when a patient walks into an office and they come with a stack of information, we find that if they already had labels attached to them, diagnoses, if you will, we are not biased by that in how we approach our treatment. We go by what the patient is presenting right there when they are in front of you, which helps us sometimes find new diagnoses and things that might have been missed in the past. We are patient-driven, not protocol-driven. So again, we go by what the patient's diagnosis is, and we go by that and do a treatment, look at how they respond, and we modify it accordingly. The problems with a lot of the approaches nowadays is that they follow protocols. Protocols it's kind of like a cookie-cutter approach. One size fits all, and it doesn't, especially when somebody has had problems for a while, for years, like the patients we see here do. A cookie-cutter approach typically has failed them, so repeating the same thing usually does not work. The patient is in front of you, you examine them, and you formulate a treatment that's very unique and individualized, and the results are much better. It also gives you the flexibility to change your treatment as you need. And these are things that patients usually don't see in other places, and that's one of the biggest reasons they come back. They also come back because they see how well we communicate as a team. We have a psychologist here, physical therapist like myself, the physician, the nurses. We all work as a team and communicate, and that is apparent to a patient when they walk in. That's another reason they keep coming back. Dr. James Gruft is considered an expert in his field. He's been doing this for a long time, and the program we follow here is known to work. We have seen successes consistently, and this team approach that Dr. Gruft leads is very effective.
Hi, I'm Elena, physical therapist assistant, and I'm in charge of exercises and physical education part here. I like people to understand how their body works and how little changes in their posture and exercises can make a huge difference. We customize the program to our patients' needs. We do a lot of education, explaining, for example, how the posture and relaxation and the endurance work to make you feel better and feel less pain. I think the reason people come back because they feel that we do care and they feel home and welcome all the time here.
Patients here have been dealing with chronic pain for a very long time. They've seen doctor to doctor, they've gone to physical therapy, they're just given a prescription, they're sent on their way. Here, they're treated more holistically. I believe that the whole body, mind, spirit is touched for each individual. We get to know them as a person. Everybody is unique. I think they get that whole experience here. I've seen people get better. They're back to living their lives again. They're functioning again. They're becoming a part of their kids' lives again. We treat them as a person. We treat them as an individual. They're getting undivided attention here. And I just think the overall experience, they're getting better. They come back because they're not seen as a diagnosis, they're seen as a person.
I think patients come back from pain to wellness because we provide a team approach, and patients are part of that team. So we have a physician, a dietitian, physical therapists, all working together in conjunction with the patient to get them back to wellness. And it's not just on the physician or it's not just on the patient to get better, but really as a whole team.
Our center is unique with our multidisciplinary staff to treat the patient's entire body, mind, physically, nutritionally, and it makes it very easy for our patients. We have a one-stop shop for them to get all of their treatment in one area, as well as we provide a great environment and support for them so they feel comfortable coming to our center on their journey to their optimal health and wellness.